Hi, this is Dr. Tom Rogers at Performance Medicine, coming to you with the weekly podcast. Happy holidays, everybody. Um, Unfortunately, it's been raining. We haven't seen the sun in about a week. It really reminded me to talk about something that affects a lot of us during the winter, especially starting during the holidays. And that's something called seasonal affective disorder, SAD, which is appropriately named. Um, it's very common. I think all of us have some degree. Some people are pretty severe. So, what is seasonal affective disorder? Well, it's really depression, and and it's more seasonal though because in the winter time, a lot of people get sad because of many factors. It really has to do a lot with your circadian rhythms. You know, that 24-hour clock that we all have that really regulates our energy levels. And it's very important. So when the weather gets cold, it's cloudy, lately it's been rainy, um, your mood gets bad. Um, People suffer from this greatly. They get depressed. Plus, a lot of people with the holidays, they get lonely, they're sad, it brings back memories. And it's really it's really hard on a lot of people. Um, but there's a biologic reason for this, for that circadian rhythms that your body does. It kind of it's really regulated by hormones. Hormones like cortisol, melatonin, serotonin. Remember those hormones because when they get off balance, people get emotionally depressed and sometimes anxious with it. But um, plus, if you're older and you don't have a correct hormone balance with your estrogen, progesterone, testosterone, DHEA, then it makes it even worse. And a lot of people, as they go through menopause or andropause, they have a lot of sadness in their lives when they hit the holidays. So you're more likely to suffer from this, I think, as you get older. Because I deal with hormones all day long, I see this every day. Um, Plus, for the last 2.5 years, it's been rough, way, way worse because, people have been isolating. They're afraid. Um, so they don't get around other people. And humans are, we're social creatures. We need other people to be happy. People are staying home. Their immune systems are suffering because of it. Um, there's a lot of arguing going on in our current political climate about a lot of things, about a lot of controversial subjects. Um, Depression and suicides, especially among younger people, have just gone rampant. Especially young people need social contact even more than old people like me do. So it's been particularly bad on them. Um, when you talk about depression, signs of depression to look out for, not only in yourself but in other people. You better listen to your family and friends if they tell they think you're depressed because they're usually right. They're going to notice something about you before you even notice it, most likely. When you get depressed, there's no blood test for that or any. It's really a combination of symptoms. And I think the main one is that you don't enjoy things like you used to. You may get irritable. You may have a decreased libido. Um, you may have sleep difficulties. Early morning awakening is a hallmark of depression. Um, you may just feel sad or hopeless. But, I think we all kind of recognize some of these symptoms. So when you get enough of them and your family starts noticing it, or if you notice it in yourself, you need to talk to somebody about this because it can lead to serious medical problems. It can kick off medical problems. I strongly believe that a lot of autoimmune illnesses are kicked off by anxiety, which affects the gut, which the majority of your immune system is located in. So I know anxiety creates real diseases. There's always a trigger, remember that. But it's especially been bad in the last 2.5 years. 1 out of 5 healthcare workers have quit their jobs because of this. Um, they're just tired of taking care of people and being scared of it. Um, And there's all those long haulers that we're treating in the office every day. That's a real thing. It's real. 20% of Americans get at least a case of what we call the winter blues, which is really seasonal affective disorder. 20%, and that's probably way underestimated, especially worse in the northern climates, of course. And now with everybody's immune system already low because of isolation and things that have happened in the last 2.5 years, it's even worse. And now that the flu is rampant all over, we have this triple demic going on now, and it may be a difficult and long winter for a lot of people. So why am I talking about it now in mid-December? Because I want you to prepare for it. What can you do? The number one thing is recognize it and prepare for this. And especially if you're prone to have depression or anxiety, especially bipolar illnesses, whatever the spectrum on that is, you need to get ready. So you need to think about this. Engage with other people. Tell people about your problem. Go to the doctor if you think it's a serious problem. And if you think it is, it usually is. But do things that are kind of new for you, like join a bowling league, get out in the winter, volunteer, get a new hobby. You can really take advantage of the bad weather with a lot of other activities. I know for me, I'm playing a lot more guitar. I've even learned how to bake sourdough bread, which is the only kind of bread I really eat anymore, which is kind of fun. I'm a guy that really can't cook an egg, but amazingly, under the direction of Steve Nice, I've been able to learn how to bake sourdough bread. There's a lot of steps, but it's kind of been fun for me. Speaking of that, look at your diet. That's another thing you can do to kind of prevent depression and the seasonal affective disorder. People that are depressed crave comfort foods, and especially around the holidays, like sugar, the number one toxin that we deal with. Depressed people crave carbohydrates. There's no doubt about it. And we're all prone to eating worse during the holidays, so especially sugar. The average American, in fact, gains 8 pounds between Thanksgiving and New Year's. That's your average American. And again, your average American is obese. The main thing I do besides hormones in my clinic, get people to lose weight because it helps everything. We live in an obese nation. Now, I'm not saying that you need to totally avoid holiday treats. You're not going to do that. But what I'm saying is be aware of it and eat less of it. Way less. And avoid excessive alcohol as well. Alcohol is a depressant, so you got to remember that. Plus, it's a weight gainer. You need to get outside and exercise. Walk outside. There's no excuse for any weather or anything for not ever getting outdoors. You can bundle up. There's no excuse ever for this. There's a lot less sun out. So I recommend light boxes. I have a couple of these in my office. You need to get one. They're inexpensive. They need to have 10,000 lux, and you start out at about 20 minutes. Best time's probably the first thing in the morning when you get up, but you can use them at any time. And they're not just light bulbs. They're special lights. But try that if you really suffer from that. That's a good non-pharmaceutical way to reverse depression. There's something I've also recently purchased, and that's a dawn simulator. And what this is, instead of an alarm clock, which I haven't used one in years, I hate them. It looks like a globe, and as the natural day gets brighter inside the dark, cool bedroom that I hope you're sleeping in, it starts getting lighter and starts putting out this special kind of light that slowly wakes you up instead of jarring you awake with a buzz or something. That's really not great for you. But this dawn simulator, they're pretty cool. It'd be a great holiday gift. Also, think about an Aura ring. I love my Aura ring. I mean, I couldn't get by without that because it really gives me a lot of information about how I slept, what my heart rate variability is, how much exercise, what my body temperature at night is. So many things. Look on some of my previous podcasts and we'll go over the Aura ring. I love it. Now, I don't use prescription antidepressants nearly as much as I used to, but I still use them. I mean, I'm kind of like the best of traditional and alternative. I don't get too far on either side and go nuts with it. So I use a lot of common sense, and I'm not going to ignore using a good medication when you need it, like an antidepressant. But I usually try other things first unless it's really severe. And I mean, maybe if you're having panic attacks and extreme anxiety, sometimes I will use an SSRI on you. But I use a lot of saffron. Saffron's very safe. It's not going to hurt you. It's a spice. It comes in a pill. I love it. I take it. That I've used a lot of saffron for anxiety and depression, and it also is a pretty good weight loss supplement as well. That's what I first used it for years ago. But look at all the literature on saffron. Works at least as good as Prozac. Probably better without the side effects. I mean, a lot of the SSRIs cause a lot of side effects. And I like CBD. I have 4 different types at my office that we've formulated. I like melatonin. It's not for everybody. You need to work with the correct dose. Some people have to take more than you'd think, but it's very safe, and it kind of mimics some of the natural circadian rhythms that we talked about. I like aromatherapy with diffusers. I think essential oils are great. One thing about successful people is they all have routines. So I think you need a good routine. Go to bed at the same time, get up at the same time, exercise at the same time, which you need to do some of daily. There's no doubt about that in anybody's mind. Exercise is the best health tool you'll ever find, mentally and physically. Not a great weight loss tool. That's more what you put in your mouth. But exercise is so good for you that if I don't get my exercise every day, then, I don't have energy. I don't sleep well. I don't feel good. I get irritable. So get in a routine. You can overdo a routine. You don't need to get OCD about it, but get in a good routine. Sleep and exercise. I really like yoga. I do a lot more yoga in the winter than I do in the summer, for sure. In the summer, I do more bike riding and things like that, hiking. I always do resistance training. You need resistance training, especially as you get older. I mean, that is mandatory. Muscle strength equals bone strength equals brain strength is the way I put it. The other thing I do, I take a week off. I wish I could take more. Maybe when I get old, I will. Like I'm not old. But I always go down to South Florida for a week in the winter. I'd like to go more, and maybe I will someday. But in the meantime, it's good to take a vacation in the middle of the winter, someplace warmer. So I do that every year. It just rejuvenates me. Like I said, watch out for too much alcohol during the winter. A lot of people drink too much. It's a depressant. And please, over anything you hear from this today, please take vitamin D and check your levels. You don't know what your level is unless you get a cheap blood test for it. It always comes on the Cleveland panel. But it's the most important supplement you'll ever take. It's actually a hormone, as you know. We've talked about it so many times. I've even stood on the side of the interstate with a cardboard sign, "Take your vitamin D," when the pandemic first hit. It does so many things, from helping to prevent your cancer risk to your diabetic risk to your heart risk. It boosts your immune system. So please get your levels checked, because especially in the winter, your levels is going to be lower. And I like D with K. Remember that. Vitamin K needs to be in there. So winter is a good time to reboot yourself a little bit too. It's a good time to go to your doctor, for your routine checkups and maybe some of your routine tests, like maybe the mammogram you've been putting off, or your colonoscopy, or maybe some minor surgeries, get your skin looked at. I always use the 5FU combination on my skin every year starting around Christmas. So I get rid of all those actinic keratosis, smooth the skin over, decrease your risk of skin cancer, which I've had. And all of us, if we live long enough, we're probably going to have a skin cancer too. Hopefully not a bad kind, but I'm really a big believer in using 5FU during the winter. You don't want to use it in the summer because you don't want to get sun on it. But anyway, catch up on things. Maybe even that little minor surgical procedure that you've been putting off. Great time to see Kelly for a lot of facial stuff as well. But and also a great time to learn how to cook different things. We have a nutritionist, Lucas Smith, who gives cooking classes, and I'm going to get him to do one on eating for the holidays. So keep your eye out about Lucas. He's an amazing nutritionist and chef, and just such an entertaining hour or so that he can spend with you and teach you a lot of things about nutrition, supplements, how to cook, how to make things taste good without sugar. It's been amazing, some of his classes that we've put on so far. So get ready for the winter. Don't just tolerate it, embrace it. People that have a good attitude, a positive attitude, are so much more healthy than those with a negative attitude. So winters can be a good time to kind of rethink things, reinvent yourself, catch up on those things health-wise and fun-wise that you ordinarily would put off. Gosh, remember, the winter is a very short time, especially here where we live in East Tennessee. It's very short. Spring will be here before we know it. Time flies. So I hope you enjoy the holidays. Think about talking with someone if you do need rebalance, if you do think seasonal affective disorder or any kind of anxiety, depression. You can't be a family doc for 36 years and not see this every day in your office. In fact, it's way more than 50% of what we see is related to stress and depression. They always go hand in hand. So I hope you have a good winter. Good time to get your Cleveland Heart panel to kind of see where you stand and take some corrective measures. Reboot yourself, enjoy the holidays, and enjoy the winter. It can be wonderful. I hope to see you next week. Thank you.